I just had a long conversation with our region director here last night. I'm going to, here's what I will say, right? And the reason why I'm going to be kind of limited here is because I have some follow-up conversations to have with DHS this next week here. And so I think it's probably appropriate, as opposed to DHS director reading something in the news, I have a frank conversation on a few things. That being said, I will say this. You know, mental health is going through a variety of changes here in the state. I am not sure if I like all the direction things are going, but I will say this. Mental health funding, as well as how we are synchronizing services, is a lot further along here now than it was 5 years ago. And I think everyone, you know, depending on whatever this newest iteration is now, everyone can agree upon that. I think people have been coming to these things for a while. Would certainly recall some of my fervor back in 2021 when literally we were funding mental health based upon what zip code you were in and what the discussion was on the local property tax levies. So we had a vast discrimination built into code where a lot of tax groups were essentially dictating how much the mental health funding would be here in the state for a variety of economic reasons, and I'll leave it here at that. One of the best things that we ever did, and I'll still hold true to this date, is that we basically ripped out that entire funding system. And the system has a lot more money, tens of millions of dollars pouring into it now than it was just 5 years ago. That being said, that kind of caused a cascade effect on things throughout the system, because what we since found is that as we rebuilt the funding structure and raised the funding for all Iowans and made all Iowans equal and how they, you know, the dollar-for-dollar mental health service, we found that there were some regions out there that were dramatically failing. And again, the regional map, this is kind of in the past here a little bit, I'm just giving a quick little history. The mental health regions were constructed basically upon who wanted to pay what on property taxes, not on where the services were at, not on a regional approach or nothing along those lines. So when we ripped out the funding and it essentially exposed a larger problem where some of these regions were not delivering anything at all. Or what they were delivering was certainly not aligned with what was required by state code, and it certainly wasn't a quality product. So therefore, the state started getting, we had multiple lawsuits where the state was on the liability for something that we were funding, but we had no administration actually making sure the quality was there. We had state laws saying the region, you have to provide this, and we were pouring the money to the regions there, but the regions weren't doing it. The regions did take financial responsibility. The state got put on the hook. So therefore, this last thing, a year ago, we passed a larger mental health bill to basically regionalize this system, which I think the spirit of the bill is still the right thing, because we have some regions that the state did not come in that would absolutely fail. They did not have the skill or the ability to actually deliver a service, and there's a better service out there for those residents. That being said, some things that have occurred here with how it's become less of a region and more of a statewide format is where my conversations will go towards next week. So when it comes to, I think, answering the question, you do have people here that are acutely aware of what is going on to this date here, but I still have to come back to where we started off at was, from a statewide standpoint, was abysmal on how we funded it and how we provided services, and we're going to have to work through some of these issues further, and I'll leave my comments there.
Yeah.